sitting chair of ReSHAPING, which is an international research institute network of scholars in social work, public health, public policy, and psychology dedicated to collaborative research and understanding the needs and improving outcomes related to sexual health and parenting for youth who are homeless, trafficked, or in out-of-home environments, whether in child welfare, juvenile justice, or other systems. It is my pleasure to be able to introduce you today, and it is also my pleasure to be able to introduce to you my friend and colleague, Justin Hardy. Justin is a doctoral student, doctoral candidate at the Crown Family School of Social Work at the University of Chicago, and has worked for many years in the Cook Department of Children and Family Services, which is Chicago, Illinois, as a caseworker in the child welfare system, primarily focusing on young men who become parents in care. In addition to this work, he also works with a research team at the University of Chicago to evaluate programs for youth in transition out of foster care in the state of California. His master's degree is from the Jane Addams School of Social Work at the University of Illinois at Chicago, and he brings a wealth of experience and knowledge to his presentation today on young fathers in foster care. And with that, I will hand it over to Justin.
Thank you very much, Claudette. Give me 1 second to share my slides. All right, can you all see that? Great, okay. So thanks again, my name is Justin Hardy. I'm a 7th year doctoral student at the University of Chicago, and I'll be discussing fathers in foster care with y'all today. So just in short, I'll be going over just my general interest in understanding fathers in foster care. I'll be going over some related research that's pertinent to fathers in care. I'll be talking about direct research as well. And then I'll end with some guidance and resources on working with fathers in care. So just as a bit of a background, I have a personal lived experience with the child welfare system. I spent a portion of my childhood in the child welfare system. So I think it brings an interesting take to this because I've gotten involvement in, I've practiced in, and I've also been able to research the very same network. So practice-wise, as a foster care caseworker, I had young fathers on my caseload, and without really a lot of guidance around serving them. So just kind of in practice, I would have to piece things together and just kind of figure things out on my own. But that came with a whole set of limitations. And so I ended up leaving practice to enter my doctoral studies so I could better research and understand fathers in care. And then while I've been in the doctoral program, I've gained research experience on the Cal Youth Studies, the longitudinal study of youth aging out of the child welfare system in California, and then Dads Matter, which is a modular intervention to home visiting services that focus on fathers. And my dissertation is a qualitative study on Black fathers in foster care in Chicago. So before I go into this research, I just want to highlight 2 things. One, we don't know a lot about fathers in foster care, or I should say has not been a lot of studies done specifically on fathers in foster care. That doesn't mean that there's research that we can use to kind of fill in those gaps. There's a whole bunch of literature that relates to fathers in foster care that I'll highlight. And then as I go through it, I'll kind of pose some questions that I think are important of that on what we can learn from that related research in understanding fathers in foster care. And then I'll move on to research that directly relates to fathers in care. So start with fathers have a very important role to play in their children's lives. They have positive benefits on children's social, emotional, behavioral outcomes, positive involvement can improve the trajectory of children's development and life course. Studies consistently show that fathers have a bit of a distinct style of play, interaction, communication that shapes children positively. Father involvement, child maltreatment, domestic violence, family separation, and lead to overall well-being and safety of the family. So kind of sprinkled through this presentation, I'm going to put up questions that are just rhetorical, but they're questions that I thought about as I read this research that isn't directly on fathers in foster care, but I think provides some insight into their lives. So, and these, largely related to practice and research. So given that we know fathers have a positive role to play in their children's lives, how can we leverage that research with the fathers that we serve so we can better engage them to improve the outcomes of their children and improve their involvement. So I'm going to go through some just quick kind of major theoretical ways that we understand father involvement. Because typically when we think of father involvement, we just think of a father's interaction with the kid or making sure that the father is financially responsible for the child. But really, fatherhood is far more complex than that. And so I want to pull in some research that we use in other areas of fatherhood research to show kind of really what we're not looking at with fathers in care. So when we say father involvement, really what it boils down to is kind of three components. There's father engagement, which is his direct interaction with the child. The second one's accessibility, making himself available to the child. And then responsibility, providing provisions of support for children. Father involvement can also be theorized as key tasks. So here, Pleck highlights really 5 key tasks that involved with father involvement. A father's positive engagement with his child, a father's ability, capacity to show warmth and responsiveness to his child, control through parental monitoring, indirect care, so things that fathers do for their children without directly interacting with this child. So things like setting up appointments, following up with the school to see how the kid's doing, and then process responsibility. That's a father taking responsibility for the task and monitoring of his child's needs. Father involvement can also be theorized as roles, and so these are just a brief summary of some of the roles that often thought about with fatherhood. There's this remote role where fathers may not see their role as being in caregiving. The provider role, where the fathers are the ones that are contributing to the primarily to the financial support of the child. A father may be a secondary caregiver, where he's just kind of helping mom out with things, really not only when she asks. There's the shared caregiver role, where it's more equally shared in co-parenting. So no one really does anything. It's just whatever needs to be done with the child, the mother or father does. And then the primary caregiver role, and this is where the father's the principal caregiver. And then there's a whole bunch of different task-based roles, like a father may identify himself as being a disciplinarian or a nurturer, things that are more aligned with tasks. And so why are those things important? Why is it important to understand those levels of involvement on different ways of looking at it? It's because I don't think that for fathers in care, we're really aware of any level of involvement. We may have an idea if they're communicating with their kid or having visits with their kid, but at least if there's any indication of what the research shows, we don't know anything about the depth of that involvement. So all those kind of theories I just went through, I think that we need to know more about those in the context of the fathers that we serve in research. So there are also contextual factors. So there's this idea in fatherhood research around responsible fathering. Like what do we need in order for fathers to be kind of responsible fathers? And that's a little bit value laden, but I think it provides a framework that helps us understand why it's important to be having a better understanding of things that may affect a father's ability to parent. So there's things like father factors, things that relate directly to the father that may influence his ability to father. things that have to do with the mother, and then this kind of triad between the father and mother in terms of co-parenting. There's also child factors that relate to the child that may affect a father's ability to parent. And then there's also contextual factors, which I argue, I mean, a lot of researchers argue, perhaps is one of the most limiting or one of the most significant influences on a father's ability to parent, are these kind of outside social forces, the macro forces that affect his parenting. So there's also expectations that we hold of fathers. So these are 4 expectations that are commonly associated with a responsible father. And I'll get to it in a minute, but largely these are expectations that we hold of older, more mature fathers. And I think it's problematic when it comes to younger fathers. But basically, we expect fathers to establish their paternity, to share in the care with mother around the emotional and physical needs of the children, and then help provide financial support for the kid. But I often think in terms of fathers in foster care, what expectations that we have of these fathers, and for the expectations that we have of them, are we doing anything, or are we helping them meet these expectations? And then with these expectations, are we taking into account contextual factors that may limit the father's ability to meet the expectations that we hold of them? In terms of young fathers, research has been done on young fathers that largely reflects the fact that they struggle to meet traditional fatherhood expectations of fathers who may be a little bit older, a little bit more mature, and have been involved in the labor force for a period of time. But basically, and again, this research is not directly on fathers in foster care, but fathers in foster care. I mean, they're males that come from these populations, and also they're young fathers. So I think we can look at this research to provide insight into the fathers that we work with. But research around young fathers show that they may not be emotionally prepared for fatherhood yet. And they may not be emotionally prepared to manage a relationship with the child's mother because of delayed labor force and difficulties completing education or work training, things of that sort. It may make it difficult for them to meet the financial expectations we have for them to be responsible for their kid. So I think for fathers in foster care, are we holding these fathers to expectations that we hold of older fathers? And when we do that, is it an unrealistic expectation? And if that's the case, are we preparing fathers in care to meet the same expectations we have of fathers in contact with the child welfare system? So I think that, to provide some context to that question, oftentimes when we have fathers who have children involved in the foster care system, we expect these fathers to be doing a bunch of things. We expect them to be employed. We expect them to be providing, emotional, physical care to their children. We kind of hold them to this very high pedestal in order for them to be reunified with their child. But then for fathers that are in foster care that are preparing to live care, have we set them up to meet those expectations? I'm not necessarily sure that we have, but I think we can get there. For racial and ethnic minority fathers, which, when you look at disproportionality in the child welfare system, we have a large amount of racial and ethnic minority fathers in care. They come from communities that have conditions which research makes it difficult for fathers to parent. When fathers have an unequal access to quality education, and it may lead to them not being able to complete their education. And if you pair that with labor market difficulties and under or low employment, things like housing segregation, social isolation, inequality, and then pretty harsh welfare policies, it really builds these conditions in which, through no really fault of the father, they have a whole host of kind of things stacked up against them that's making it difficult for them to be the fathers that they want to be. And so I think for fathers in care, particularly for racial and ethnic minority fathers, are they facing these same contextual factors in the communities in which they live? I think they are. And if they are, then what are we doing to help them overcome these obstacles and barriers? And I should say that, when I read this research, it seems a little bit pathologizing. And I think it is. But when you look at the research, I think it reflects just what these fathers are going through to be good fathers. So basically, against all these disadvantages that I just listed, and really against the odds, racial and ethnic minority fathers are doing a pretty good job of being involved in the lives of their children. They're assuming and fulfilling fatherhood responsibilities, regardless if they're resident or non-resident. Research shows that they consistently remain deeply involved. They show resiliency and ability to adapt their parenting style with little resources, and in the face of a number of societal challenges and difficult contexts. And then, they're able to kind of change the narrative on how we think of fatherhood. And so I think for fathers in care, are these experiences similar for the fathers that we work with? And, like the slide shows, my racial and ethnic minority fathers are doing really good jobs of being parents under difficult circumstances. With that being the case, are we as caseworkers connecting these fathers with paternal supports in their family that can help them help support them when certainly the child welfare system is facing a difficult time doing that. And so the last piece of related research I want to highlight is that there's research studies done on fathers that are in contact with the child welfare system, fathers whose children are in foster care. And that research shows that the child welfare system has a very difficult time serving these fathers. The research shows that when fathers are involved in the lives of their children that are in foster care, that increased involvement can decrease foster care placement. It can reduce the time that their kids spend in care. And then it can increase the likelihood of reunification. And then if reunification is not possible, it has been consistently shown to increase the likelihood that the children will be placed in kinship care. But despite this positive research, child welfare agencies still struggle to engage fathers in services. There's been studies that reflect that this difficulty in engagement may be because of workers may view fathers or father engagement as not being beneficial to child outcomes. It may not be beneficial to child welfare planning. And then, gendered, racial perceptions of minority fathers has been other pieces of evidence that may reflect why the child welfare system has a difficult time engaging dads who have their children in care. So I think a pretty significant question is, how can a system that struggles to serve fathers with children in foster care adequately serve fathers who are in foster care? And I think about the ways in which really both groups of fathers need to be better served. So are there ways that we can kind of unify services that are, or existing services that are focused on increasing father engagement? Can those be adapted to also include fathers in foster care? Okay, so now I'm going to move on to direct research with fathers in care. So this is research that is done directly with fathers in foster care. Okay, so the first area of research is around expectant and parenting foster youth. So in terms of expected outcomes or pregnancy for females, research consistently, or I should say consistently, research tends to focus on females. And for fathers, or for studies that exclude fathers, they often discuss that fathers are left out of analyses because it's difficult to understand if the father's reports are accurate or not, and they often tend to be undercounts. Parents in foster care are more likely to experience pregnancy compared to the non-foster care youth. And some predictors of it are substance use, infrequent birth control use, and placement instability. In terms of parenting outcomes, again, research focuses on females. Analyses discuss the ways in which fathers' reports may not be accurate. Children of youth have a study shows that children of youth have higher rates of child welfare involvement, and then few studies explore parental involvement in depth. And so when you think about preparedness for expectancy and parenthood, parents in foster care may not be developmentally or emotionally prepared for parenthood or pregnancy. And because of low education attainment, employment, it makes it difficult for them to be the parents that they want and to be able to support their children. So this is from findings from the CalU study that where we look at expectant and parenting outcomes for males and females. This one is focused on males. So by age 21, around 40% of the fathers or males had gotten a female pregnant. 20% of them had fathered a child. At the most recent pregnancy, 20% wanted the partner to become pregnant, and around 70% wanted to marry the partner at the time of the pregnancy. So I think this reflects the fact that for males in the study, having 70% wanting to marry their partner at the time of the pregnancy, I think shows a level of commitment that I think is often associated with young fathers. So in terms of parenting outcomes, of the males, 15% had a living child, and then among the fathers, around 80% only had one living child. And then in terms of the residency of the child, fathers were more likely than mothers to be a non-resident parent. So that is research that has been conducted on, there's been a number of studies. I think that one has the most amount of data. But I think that, there's a lot more we can understand about fathers in care. So I want to highlight two pieces of research that I'm currently doing right now that looks to have a deeper understanding of fathers in foster care. So the first one, it's largely driven by a question that I had on it's basically, what do we know about fathers in foster care? So kind of taking all the research that's out there, putting it in one place and just seeing what we came up with. So I did a analysis with another researcher, Dr. Kristen Ether, where we do scoping and review of 93 sources of evidence, papers, articles that span 40 years that I'll share findings with here in a second. And then I'm going to share some findings from my dissertation study on young Black fathers in care. So there's a lot here, but I think the findings that we had will not be a surprise to most of you. So over those 40 years, over 93 sources of evidence, what we found is that mothers in care are consistently the focus of that research. If fathers are included, the findings and guidance are often in the aggregate. So they will discuss findings around parenting youth, but they won't separate out moms and dads. So it's difficult to ascertain what the precise finding was for fathers only. But even when fathers were included, even when the findings were aggregated, the content still focused on mothers in care, or they used female pronouns. So they would say, parents in care face difficulties in X. And then it would go on to say, for example, moms do this, or she does this, or things that reflect that they apparently didn't have the father in mind when they were writing up the data or the findings. There were a number of reasons on why fathers were excluded from studies when they were shared. The most commonly cited rationale for why they were excluded was that there were too few fathers, that the findings for fathers were unreliable because there's no way to confirm the data, or for longitudinal studies, there's low attrition. For papers that were, or for research studies, a number of them discussed the need to do they discussed the need to do future research to better focus on fathers in care. Practice-related papers reported that, or gave guidance around that fathers had the same needs as mothers in care. So a lot of the practice-related papers didn't provide any significant insight beyond just, don't forget that there's fathers in care, and that you should make sure that you're helping them out too. Legal papers, there's a lot more content around fathers in the legal papers and the policy papers. The legal papers tended to focus on paternity establishment, and then with that establishment, that being the doorway to being able to have certain paternal rights. And then policy papers discuss ways in which data tracking and data collection can be improved, so we know more about fathers in care, and then also how existing fatherhood interventions can be developed for fathers in care. All right, so moving on to my dissertation study. So in my dissertation study, I focused on 3 questions. This was the first one. So the first one was, wanting to know more about their experiences in care. So I asked them, I asked a number of questions that get to this first question on, who has taught them about fatherhood while they've been in care. Initially, and so I just asked an open-ended question. I'd say, while you've been in foster care, who has talked to you about fatherhood? So that gives them an opportunity to kind of say who may be helping them the most, or I don't directly ask them if it's anyone from the foster care system, unless they don't respond with someone in the foster care system. And so far, none of the fathers that I've talked to initially say anyone from the foster care system. They always point to themselves, basically saying, I had to teach myself about fatherhood. I kind of don't have anyone looking out for me. I didn't have a positive experience with my father, so I kind of had to figure it out on my own. They also cited other people that have talked to them about fatherhood while they've been in care. They identified their mothers as being, the most significant support after them, but also paternal family members, uncles, other relatives, friends, male friends as well. And then, so once, after they didn't say anyone from the foster care system, then I would ask, okay, has there been anyone in the foster care system that has talked to you about fatherhood? And most of them reported that they had not. They reported that foster care staff had talked to them about their need to participate in services without really giving a lot of rationale for it, or letting them know what services were available. Some foster care staff talked to them about the need for them to take care of their children, but these fathers really didn't share anything meaningful around how to get there. There's one youth who reported that someone from the foster care system did kind of directly speak to them about fatherhood, but it wasn't someone that was assigned to them. It was a male in the agency that kind of knew what was going on with them and kind of pulled them aside and talked to them about fatherhood a couple times. But fathers did report that GALs and CASAs frequently asked them about their children whenever they had meetings or phone calls with them. So my next question was, what was fatherhood like while even in foster care? And fathers discussed a lot of obstacles that the foster care system has kind of put in their way that has limited their ability to be parents. First, fathers reported that residential placements in groups' homes weren't conducive for children to visit. There's just a lot going on there. And, between conflicts with other youth or just the way that they're structured, it wasn't an environment that they wanted their kids to visit. And so then they'd have to leave anytime they wanted to see their kid. But this proved to be a little bit problematic because different residential placements or group homes, they have different rules that prevent the father from leaving. Fathers also reported that overnight restrictions, not being able to have an overnight with their girlfriend or their child's mother in order to spend time at night or late in the evening to help mom out. Particularly when mom had just come home from the hospital, by fathers not being able to stay out late or stay overnight, it really limited their ability to help mom during this during the transition from the hospital to home. And also, some of the fathers reported that the foster parents disapproved or created tension in the home, or when that happened, it made it difficult for the father to want to be around the foster parents with the kids. And so those are just some of the I think important findings. Also, I think which is really telling is just kind of the what's going on in the world right now that also interacts with the child welfare system. So fathers reported different COVID restrictions made it difficult for them, nearly impossible to leave placement to go see their kids, or if they were able to leave placement, moms or the maternal families had hesitancy around letting them in, knowing that they've been in placements with a bunch of other people. Fathers also shared that these recent police killings really made them kind of assess their kind of role in fatherhood and how if they were killed or if they were arrested, how that would impact their relationship with their child or make it such that they wouldn't be able to see their kids. So the last question I asked was, what do you need to raise children while you're in care? And so for this, I asked a number of different questions, but I think it was interesting to hear some of these responses. So some of the fathers reported that they feared the child welfare system would take their kid away from them. And so they're reluctant to engage in any service where they have to openly share any obstacles or struggles that they're facing, because they fear that if they might share something that may get their child taken away from them. They reported that for fathers that did participate, they reported that they weren't really that kind of in tune or engaged with the service because it was very clear that it focused on mothers. But it was interesting for the fathers that did participate. That they said the main takeaway that they got out of it was that the information that they received around child development and information was really helpful and really interesting. And the fathers discussed the ways in which having this information really helped them understand some of the kind of normative developmental stages that their kids were going through, and help them understand, why kids were getting fussy at this age. And so I think fathers got a lot out of that. Not so much the kind of mother-focused elements of it. Fathers reported that there's little services or information around co-parenting, establishing paternity, and then if they establish paternity, what would happen with child support. That was a big thing. So fathers who already kind of struggled to meet the financial expectations of supporting their kids were worried that if they did establish paternity, that child welfare would kick in, child support would kick in, and then make it even more difficult for them to financially support themselves, let alone their kids. Fathers express a desire for there to be more flexible rules around placements to see their kids, and then wanting to have education and employment supports so they can meet the expectations of fatherhood. So just some kind of summaries and main takeaways from my scoping review and then my dissertation study is that this idea of corporate parenting. So, corporate parenting is child welfare systems founded on this. When we think a parent is no longer fit to care for a child, the state takes over and says, okay, well, now we're going to step in and we're going to be the parent. So in this capacity, I mean, now the corporate parenting kind of turns into corporate grandparenting. So like, okay, so now what's the state going to do to ensure that their kid who's in care is able to care for the state's now grandchild, even though they're not in care? It's kind of theoretical piece to it. I think placements need to provide a sense of normalcy, the same normalcy that we give for older youth, and letting them kind of step out and take some risks that are known to be beneficial for normative development, having that same level of normalcy and letting young fathers have accommodations so they can see their kids. I think services around child safety are important, but I think they're useless if we're not doing things to support fathers being able to see their kids. I think agencies need to find better ways to track fathers in care and collect data on them. I think agencies need to provide services and tailor those services accordingly. I think it's important to think about the ways in which we can engage fathers that's different in the ways in which we engage mothers. And I think that this idea around paternity establishment, I think is important. I think, or at least in where I was at, we worked really hard with fathers to establish paternity so they had certain parental rights, but that comes with a caveat that now we're going to introduce them to another system that can be a bit limiting and complex to navigate. Okay, so now I'm going to move on to working with fathers, and I want to save time at the end for questions. So, working with fathers. So there's a lot on these next few slides. I'm not going to go through all of them, but I want to leave them there for folks to have. But I'll just briefly kind of highlight what I think is some main things we could be doing to better work with dads. So first, I think we need to be tailoring our case management for fathers. So I think we need to have more frequent check-ins with male youth around sexual health, expectancy, and then parenting. I think that we need fatherhood research shows that the earlier that you engage fathers in services and also in the life of their children has positive outcomes later in life, particularly when it comes to engaging fathers around pre and postnatal health. It gets them more involved in the life of their child and kind of helps them understand their role in child development. So I think we need to be talking about fathers about things like that instead of just you need to be involved in the life of your kid. I think we need to be talking to them about how they can be better involved in the life of their kid. I think we need to connect fathers with resources that will help them be better fathers, to be the fathers that they want to be. And I think that will help build up their identity and their role around fatherhood. I think that can be sustained as the father gets older and that the transition out of care. And I think we need to be working with foster care parents and placement staff to make sure that they're allowing fathers the room, the space, the time, and the supports to be engaged in the life of their children. I think we need to provide father-focused services, and I think that there's ways in which we can adapt existing services to do that. Here are a list of different ways I think we can do that. I think that the biggest thing is just understanding that fathers and father involvement it's diverse, it's complex, it's deep, and making sure that we provide a range of services that kind of span the various levels of father involvement. And then in I think we need to improve father engagement in services. So here are a list of ways I think that we can better engage fathers in the services that we already have, or connecting them or referring them to existing national and local fatherhood programs. But basically, ensuring that we have options that are available, that are focused on fathers and that are just not mother-focused services that are kind of lightly adapted to fathers. I think that we need to work hard to have a strength-based approach with fathers, to really leverage their existing strengths that are within them, but also within the paternal family. I think we need to be looking at the ways in which we can help reduce barriers faced by fathers in care, and looking outside of just the individual case and case factors to also look at different contextual factors. And I think we need to provide better training for fathers in care to our staff. And I think here are some things we can look at when we start to do that. So here are some resources that I found very helpful in my practice and my research and better understanding fathers in care. These slides will be made available to you. When they are, you can click on these headers and they'll take you directly there. But if you want to search for them, they're there. So thank you. I want to quickly just send a big thank you to folks that have been influential in how I understand fatherhood, the research that I do. Dr. Gleason from UIC, Tracy Levine from Lawrence Hall, from when I was a caseworker, really helped me with fathers. My dissertation committee, and then also, and I can't underscore this enough, recruitment. I do recruitment through an agency called TPSN in Chicago, and Alnita, Stephanie, and Zach have been absolutely instrumental in helping me connect me with caseworkers to get fathers into my study. And without them, I definitely wouldn't be able to share these great findings with you. So if you have any questions, here are a bunch of ways to get a hold of me, and I want to take up any questions that y'all may have.
Thank you so much, Justin, for that. This is Janet at Healthy Teen Network. Thank you all so much for joining us today for this presentation. At this time, you can drop any questions that you have in the chat box. I'll help Justin take a look at them if he's talking, or feel free, you can unmute yourselves and ask the questions. There are not that many of us. I'm sure some of you are familiar folks. So we'd love to hear whatever questions you have at this time.
All right. I'm curious to hear if you have any suggestions how to successfully recruit fathers for research studies. Yeah, and Solana is a fellow fatherhood researcher. Yeah, it's difficult. I should say I'm doing a qualitative study, and I don't have a lot of, it's a qualitative study, so there's, the idea is you have fewer participants and you go into depth with the research that you do. And with that said, I've got 8 fathers now in my study. And again, the idea isn't for really to get a lot of fathers. You want to have very few and go into very deep depth with them. And it's taken me a very long time, and it was a very hard fight to get those fathers. I think that the biggest thing is working with them to build a rapport and letting them know that that they can trust you. And that's difficult when you have to start out the consent form by saying, if you report any information to me that indicates you may be abusing or neglecting your child, I've got to report that to the child welfare system. I think fathers are scared that they may accidentally reveal something that really that is not abuse or neglect, but may be perceived as such. So there's that. Also, I do an initial interview and then a follow-up interview. I'm shocked by the amount of young fathers, one who I may be connected with for recruitment, who are incarcerated by the time I contact them, or I'll do an interview with the father. And I've had a lot of, I've had fathers that I've been unable to do a follow-up interview with because they've been incarcerated. So yeah, it's a difficult road, but you just got to stay persistent with it. I think it is my success for recruiting them.
Listen, I just want to add, I don't know if you could see that there was some head nodding going on while you were talking about your recruitment and the challenges and the engagement. There's another question in here. Are all foster care staff often trained in life skills, parenting, education, et cetera, or only for certain positions?
So I should say that the way it works in Illinois is that if a youth is pregnant or parenting, they're automatically enrolled in through an agency at UCAN in a service called the Teen Parenting Service Network. And the Teen Parenting Service Network, they provide specialized case management for parents, in care, and including fathers. And if a father doesn't want to work with them, TPSN will provide parenting services to the caseworker. But with that said, just because they're enrolled doesn't mean that they participate. So I think the first kind of struggle is just getting them engaged in those services. And then once they are working with them, but this may vary state by state, but I don't think that when it comes to for services around fathers, they're certainly not father-focused services. There's mother-focused services, parenting-focused services, but none that specifically look at father involvement, engagement, and the different levels and components of fatherhood.
Great, thank you. Nicole, I see that you have your hand raised. Are you able to unmute yourself, or I can do that for you?
Yeah, I'm going to try this. I'm actually participating while on the road, and so I hope there's not a lot of road noise. I tried with my AirPod just in case. So this is a little odd. I know I did see some of my program staff in here, and we do work with both foster care youth and also other youth that are pregnant and parenting, particularly young fathers as well. So my question is a little bit maybe a little bit off topic, but I'm not sure. So I wanted to ask too, like how, maybe what recommendations or other thoughts you might have or research you've done related to the involvement of maybe foster families or the families of the other parents. So for example, for young fathers, the mother's families or extended family, their involvement in the maybe shutting out of the fathers. We've seen a lot of that happening in programs where the young fathers kind of get the raw end of the deal, where the families and the mothers themselves are kind of shutting out the father, not giving them a lot of, visitation or chances or opportunities to spend time with their child. And I just wondered what your thoughts were, or if you had any of that in your research or, just thoughts on it.
Yeah, so I've considered that and I've looked into that. And so when it comes to maternal gatekeeping, I think maternal gatekeeping often has a negative connotation to it. I want to stress the fact that that there are times when maternal gatekeeping is needed. If the father is engaged in activities that that a mother is concerned will put a child at harm, that they need to avoid participating in those things. And so I think a very short answer to that is, I think that fatherhood services should focus on managing the co-parental relationship. So managing a father's relationship with the child's mother. And that I think is often a foot in the door to the maternal family side, saying, okay, here is the child's father who's now is kind of stepping up and now has a good relationship with the child. I think that is a good foot in the door sometimes. But as a caseworker, it's difficult. I mean, I was a caseworker. When I do a visit a month and I need to be in and out in an hour, sometimes it's difficult for me to carve out time to get involved in that. So I think providing services that aren't, where we're not asking the caseworker to be doing those things, like maybe connecting them with a specialized caseworker that can help them manage that. You know, if you Google the Teen Parenting Service Network in Chicago, or sorry, it's across Illinois, they have specialized caseworkers. And so that kind of model is out there. I just think that now taking that model and focusing on things like fostering those relationships, I think will be helpful. I hope that answered it.
Yeah, absolutely. I appreciate that. Hopefully you can hear me now. I don't know if I am muted. So I think that was kind of where I was going with it, but also I know that a lot of we have a big push for family engagement, and we're often doing a lot of the co-parenting stuff with the fathers and the mothers. So we do that a lot. I think we just often see a lot of that pushback. And sometimes, you know, we have a great group, you know, great groups of case managers that can often kind of root out those situations where, you know, it's more, you know, where it's kind of hostile, where the mother just doesn't want the father involved for whatever reason. And then also, you know, obviously determining whether it's, you know, for good reasons. So I appreciate your input on that very much. It's definitely helpful. Thanks.
Yep, of course. And sorry, in one quick point to that, you know, when there are fathers who want to be involved in the lives of their kid and there is maternal gatekeeping taking place, I mean, the father can establish paternity, and when those situations arise, I think the foster care system needs to step up and help those fathers exercise their paternal rights to have visitation with their children.
Great, thank you. I just wanted to point out, we do have one more question in the chat that I think we have time for. And then no, Svetlana, we couldn't hear you trying to speak earlier, so I'm sorry about that, but we see your response in the chat. So there's a question about, should pre-conceptual education and childbirth preparation education be offered to foster care fathers? What are your thoughts about that?
Sorry, so yeah, so I mean, particularly around childbirth preparation. And so a kind of side project that I have is I've developed a father-focused enhancement to doula services, and that, you know, largely helps provide, or I mean, I haven't piloted it yet, but the idea is that fathers should be, or let me step back for a second. Research with fathers, period, show that it's beneficial for them to be provided those services. So one, they can support mom and improve mom, maternal and child health outcomes. But two, that engagement early on before the child's born and having a stake in it then has been shown to help increase and sustain father involvement later after childbirth. And with all these studies coming out on things like postpartum depression for fathers, things like that, I think that, yes, of course, I think we need to be providing those types of education for fathers as well.
Great, thank you. And I just wanted to make sure that you did see the response from Svetlana, since we weren't able to hear her.
Oh, thank you, Svetlana. I appreciate it. It's nice to know that other people feel my pain.
Yes, I don't know if you can hear me now. Maybe
now we can.
Yeah, I can hear you.
We can hear you now.
Okay, new computer. It's been tough trying to recruit dads. So I absolutely feel your pain, and it's really helpful to hear kind of how you go about it and the suggestions that you have. And I think you have really good insight about this. And I agree with you. Trust is key, and sometimes kind of the most untangible thing that we could try to do as researchers, right? So it's difficult and necessary. So I really appreciate this.
Of course, you know, in another element of that makes it a little bit difficult is I do my recruitment through the caseworker. So I'm connected to a caseworker, and then that caseworker connects me to the father. And I've also experienced what I perceive to be caseworkers who fear that the father is going to say, my caseworker does not talk to me about fatherhood at all, and are very concerned on why I want to talk to the father before they'll put me in contact with them. So I think that's also can be a barrier to engaging fathers. So I would love to connect and put together. And I saw Dr. Ricks also said, feels pain. Yeah, we should definitely put something together where we're trying to target better engaging fathers in research studies.
Yeah, I think it's a great idea. I think we should connect and think about how to do that.
Absolutely. I'll email you.
Okay.
Well, I was just going to say we're just at about 4 o'clock, but I wanted to use this moment just to remind everyone that you can find Justin's contact information in the slide deck that we'll be sharing out. It will all be posted, including the recording on the ReShaping website. You'll be able to contact him. And I know we'll be pushing out again the link to the recording and how to find him, because it sounds like a number of you would love to connect and keep this conversation going. Justin, anything else before we wrap things up?
Yeah, no, thank you very much for participating. And again, I was a foster care caseworker working with young dads. I know it's difficult. I know it's challenging when you have a bunch of other stuff to do. Hopefully, I provided some tips that can help you do that. But again, if you need some advice, or if you're an agency that is trying to revamp something or want me to take a look at something, feel free to email me. I'd definitely love to help support you all in any way that I can.
Thank you, everybody.
Thank you.